Hi, my name is Dr. Jane Hendricks. Do you suffer from symptoms that are mysterious, like numbness and tingling that comes and goes or is progressing and getting worse, rashes that come and go, digestive issues, chronic fatigue, brain fog, hormonal problems, but yet the blood work for the hormones is always coming back normal, and yet you're expressing excess estrogen like endometriosis or ovarian cysts, and so you just get thrown a birth control pill. If you don't want to take that, that's the end of the line for that. These symptoms could be attributed to something that's underlying that could lead to a very severe chronic degenerative condition such as Parkinson's, multiple sclerosis, so some kind of neurological condition. And so you don't want to stop with specialized medicine. When they're done with you, then it's time to go to naturopathic medicine. Better yet, start with a naturopathic physician and avoid all the co-pays and anxiety that's caused by not having an answer sooner than later. Patients will spend years getting worked up by specialized medicine because they're going to the allergist for the allergies and the sinus problems. They're going to a dermatologist for the rash. They're going to a neurologist for the headaches and the neuropathy. And so each specialist does their specific workup without asking a lot of questions about your environment or lifestyle. And when they're done and they've ruled out all of the diagnoses that they are trained to treat, then you are sent home to deal with the symptoms over the counter, whatever you can do at home. And it's very frustrating, and it causes anxiety and depression in the patient because they know that they're suffering from these symptoms, but they have no answers. Naturopathic physicians, such as myself, are trained in many modalities to treat the cause of all of these symptoms. What if all of these symptoms were caused by one thing? Mold toxicity. I have a patient that she's been thoroughly worked up. She's got a gynecologist for what seems like excess estrogen. Even though her estrogen levels are normal in the blood, she has endometriosis. That's an excess estrogen issue. But again, they're done with her because the blood test comes back normal, and typically conventional medicine tests or checks into the labs, treating the labs more than what the patient is expressing clinical wise. Treatment, birth control pills. Neurologist for her headaches and neuropathy, works her up, does the brain MRI, negative, and that's the end of the line for that. When I start asking questions about the environment and find out that this particular patient, who's afraid that she may have multiple sclerosis, but all the tests aren't showing it, lives in a house built in 1955, and there was a leak in a wall in the office where she works at 12 hours a day. More recently, her symptoms have become more severe. More recently, she's been working in that room longer hours than she was previously. So her neuropathy is getting worse. Now she's losing hair because she's getting these different rashes that are more severe. And so once we get these questions answered, then we have a path. We can see where we want to go. We can do mold testing now. She will get tested for mold. And all of a sudden she feels more at peace because she feels like there's going to be direction now. There's going to be an answer to what is causing all of these symptoms. Not wondering if what is this going to progress to? What serious condition is this going to progress to if she doesn't know what to do about it? Once we get these tests back, and whenever you do mold, we should probably do heavy metal. The two go hand in hand. Mold causes excess estrogen. Many mold species are estrogenic. This could very well explain her clinical symptoms of excess estrogen, yet normal blood estrogen levels. So this is the value of going to a naturopathic physician, paying out of pocket for your own health. Now more than ever, I'm sad to say, conventional medicine is not doing their due diligence for patients in their chronic conditions. Go to a naturopathic physician, get your questions answered, because we are much better detectives at finding the cause of these symptoms, because we are looking at multiple systems, the digestive systems. We're not going to send you to this doctor and that doctor. We treat the whole body. We're trained from head to toe, and we're trained in how to test for different things, not just blood. We've got urine, we've got salivary, we've got all different kinds of specialty labs that are extremely scientific to find out if you have fungus, heavy metals, and look deeper into your hormones. So visit my website and learn more about naturopathic medicine and what I have to offer. I do offer 10-minute complimentary consultations. I can't get your medical history and treat you over the phone, but if you've never seen a naturopathic physician, please call and find out how does this work. Insurance-wise, there's some options there, HSA and FSA. I am out of network for United, and you can ask what the cost is. It's not that expensive. My goodness, by the time you spend all the co-pays with all these different specialists, and the co-pays for all the different blood tests, that with no answers, you might as well just have seen a naturopathic doctor for a couple times. Get empowered with the tools on how to heal your body, how to facilitate better immune system function so that you can heal yourself of the cause, whether it be a microbe or heavy metal. We've got the modalities to help you with that. Thank you for joining me today, and I hope to see you in my office. I also do virtual consultations as well.